Hi guys, welcome to my channel. This is Nia. If you're new here, welcome. To my returning viewers and subscribers, thank you so much for the continued support. So guys, today I wanted to discuss PCOS and my personal journey with PCOS. If this is a video you'll be interested in, then go ahead guys and continue to watch, because coming up I'll get right into it. So hey guys, I'm back. So first thing up, what is PCOS? PCOS, guys, is polycystic ovarian syndrome, or you could say polycystic ovaries. And that is basically enlarged ovaries with cyst that is attached to the ovary on the outer lining. Okay? Now, the causes of PCOS is still not really known medically. They don't have enough research or science to proper investigate where this thing come from or what's causing it. But they've narrowed it down to two possibilities of genetic or environmental factors. Okay, guys? So that's basically what it is. So you could definitely look it up just to have some research on your own. So some of the symptoms, because prior to the diagnosis you need to have actual symptoms for them to even know what to check for. So some of the symptoms, guys, is hair loss, and then in other women you might have excessive hair growth, which is facial hair that contributes to a beard, mustache, arm hair, stomach, all over. I fall in the category of losing my hair. I don't have excessive hair growth. Yeah, sorry about that, guys. Yeah. And also, one of the other physical attributes of PCOS is actually obesity, right? Now, not everyone that has PCOS has obesity, but it does affect a few people with obesity. And those are some of the symptoms that they would look for. Also include not ovulating, so ovulation, I think that's how they call it. Correct me if I'm pronouncing that incorrectly. But lack of ovulation, missing menstrual cycles, sometimes months out of the year, and excessive bleeding and pain during monthly cycles. And some of the research also show that it causes infertility. So those are some of the symptoms. So if you have a few of those symptoms that I mentioned off the list, you should probably get checked out and try to find out if you have PCOS. Okay? So just for disclaimer, guys, I'm not a medical professional. I'm just someone who has been diagnosed with PCOS. So all these information is from my own personal journey. So if you do have any symptoms or issue going on, please make sure to check in with your doctor and seek the relevant treatment and people who can help you. Okay? So get into diagnosis now, guys. Diagnosis. It was about 2010 when I started having excessive symptoms like the hair loss, the shedding of my hair. Like no matter what I do, my hair would always fall out. I start having scalp acne, like my face would break out. I start having severe discoloration, which they call hyperpigmentation. Like my skin, like I have 3 different shades all over my face, my back, my body. Nothing is the same shade, right? And repeatedly going to the doctor because I was missing my menstrual cycle like months at a time, 6 months, 10 months out of the year, constantly going to see my doctors, and they're sending me to the GYN. Then next they sent me to an OB/GYN because they go more in depth as far as reproductive issues, and no one could figure it out. Then we had to go through some family history, and almost 2 years before I was diagnosed. So around late 2011, early 2012, I was officially diagnosed. So I've been diagnosed with this thing for about 11 years now. And I was finally diagnosed with PCOS because I had all the symptoms and they were severe, right? So I had to do regular blood work to check my A1C level, because even though I wasn't a diabetic, one of the other symptoms of PCOS is that it mimics a lot of diabetic symptoms. So type 2 diabetic people, it mimics a lot of the symptoms. So they had to exclude diabetes from it. So I had to get my A1C level checked very often, right? And it was always okay. At one point, they said I was borderline diabetic. And then 2 weeks later, I did another blood test and it went back down to being normal. So it would fluctuate up and down, up and down. So they couldn't pinpoint what was going on. So upon suffering severely with all these symptoms, like having pain, discomfort, and a lot of stuff going on, they decided that they're going to try a treatment method, which is metformin. And if anyone knows metformin is oral medication that is used to treat type 2 diabetes. Okay, so because I was mimicking diabetic symptoms, because I was gaining weight rapidly, I was dieting, I was eating healthy, I was excluding sweet and all the stuff that they advised to exclude just to see if it would help. I was doing that, and instead of losing a pound, I was gaining weight. So they put me on a 3-month weight loss plan to see if I would lose some weight. At that point, I wasn't obese. I was overweight but wasn't obese. And instead of losing a pound in that 3 months, I end up gaining 25 pounds. And remember, I was in the doctor's office every 2 weeks getting blood tests done because they needed to keep check on my A1C level to make sure, because they had to make sure that it wasn't PCOS. They wanted to make sure that it wasn't diabetes either. So I was doing all that. So they finally conclude that it's definitely PCOS. So I continue taking metformin, 500 milligram to be exact, once a day. Within 6 months, guys, I was up to 500 milligram twice a day. Right? Within 6 months, 500 milligram twice a day. And I moved from 500 milligram throughout the years to 850 twice a day, to 1,000 twice a day. Nothing helped. The next step was for me to actually continue to follow regular medical check-in to make sure everything was okay, and that the cyst follicles weren't too large on my ovaries, because I had it on both ovaries, right? The next step was for them to introduce possibly medical, surgical, actually, I should say surgical intervention. And I didn't know much about surgery or anything because I've never had surgery. But anyway, I did my own research. I checked out a few videos online, and I told myself that because of all the possible risk of having this PCOS and it's being out of control, is affecting my physical, my mental, my emotional, everything. So I decided that I will go through the process just to learn about it, and before I get to the finish line, I will make a decision if this is something I want to do. But I'm not going to take anything off the table because this thing is out of control. Now, this particular surgical intervention would be weight loss surgery, and it was to reduce the size of my stomach, because unlike a lot of people and the perception they have of PCOS diagnosis in women in their childbearing age, not everyone that has PCOS is doing something wrong to make them have PCOS. So I wanted to go through with it because I didn't want to die, because I was at risk for high blood pressure, hypertension. I was at risk for diabetes. I was already taking diabetic medication even though I wasn't diabetic. I was at risk for heart disease. They're saying that there's a possibility of PCOS being linked into ovarian cancer. Like, it was a lot. So when you hear all these things, you're not going to take any option off the table to possibly help this thing. Now, one of the downside is there's no cure. There's no cure for PCOS. And I agreed for the weight loss surgery, right? So we are all the way up now to 2020. Did my weight loss surgery October 2020, right? Everything went well, was in a lot of pain. I recovered pretty well. So now they've reduced my stomach to barely nothing. I could barely drink 5 ounces of water, even now to present day, 3 years later. I could hardly drink 3 ounces of water without feeling like I'm overfull. So I'm unable to eat in excess, even though I wasn't before. I've been basically eating grass for the past 3 years. And I don't know for everyone, but I'm not going to say weight loss surgery didn't work for me, but I think because the PCOS itself is not being controlled, the weight loss surgery did what it was supposed to do, but the hormonal imbalance is still not in control. So even with portion control, with reduced amount of calorie, with eating more veggies and prioritizing protein and no soda and no sweet and all these stuff, I'm still not seeing the result that many have seen. Now I'm grateful because it was a tool. It's not it's not a perfect fix. It's a tool for you to actually do the work. So yeah, guys, I wanted to show you a visual of some of the scalp and hair loss and acne and stuff that I've been experiencing in the past few years. I just narrowed it down to the past like 2.5, 3 years. So I circled everything in blue so you could see the scalp acne, the thinning of the hair, receding hairline, patches in the top, and just different like holes in my face. And yeah. Hey, yeah, guys, and one of the most hurtful part of all of this is in this modern society, and this is not generalizing everyone, because it's not everyone. People are so hurtful with their words because, as I said previously, not everyone that is heavyset, overweight, obese is eating too much or is greedy. People do have health condition that causes different things. You see someone losing their hair, and the first thing that goes to a lot of people's mind is, oh, she or he must be doing something why this is happening. No, there are conditions like PCOS. I cut my hair a lot and I start over, and I have my different methods that I use that grow my hair really fast. But I would have kept my hair if not for the scalp issues and the acne and my hair falling out, like the size of my hair like falling completely out, and I have to start over. Not everyone that is overweight is greedy or is eating McDonald's or Burger King or eating junk. So before you be rude and unkind to someone, please take a look in yourself and realize that not everything that you see is exactly what it is. People are going through things. People are struggling with different things in their life, different health condition that they're battling, that they're trying to stay afloat, that they're trying to figure out how to properly handle this. And before you say anything, just be kind. And if being kind is too hard, just don't say anything. Just be kind. But guys, I'm sure I missed a lot of points because I'm here rambling, but I really needed to talk about this. I really needed to make this video because it's been weighing heavy on me, and this is just my life, my truth. I've been living this for 11 years since the diagnosis, but prior to that, I've been suffering from this condition since I was 14 years old. So it didn't just start 11 years ago. It's been since I was 14. So if I'm gonna put all of that together, I've been suffering with this condition for 20 years, but was only diagnosed properly 11 years ago. So this is just my truth. And if If you guys find all these information valuable and you would like to know any additional information, because as I said, I know I missed out a lot of stuff, please leave a comment in the comment section. I'll definitely respond to you. Again, if any of you guys know any resources, any specialist that specializes in the treatment of PCOS, feel free to drop the information or reach out to me and I'll get back to you, and just want to let anyone know out there who is dealing with PCOS, any teenagers, any young adults, even if you're a mom and trying to have kids, don't give up. Don't feel defeated. Never look at yourself and say that I'm not enough. You are enough, and you're not alone. You are not alone. There's so much people that is going through this thing in the world, but they don't know what's happening and they don't have the proper knowledge or education to actually, or I should say they don't have the proper education on PCOS to actually step forward and talk about it. So here it is, guys. So again, guys, thank you so much for the continued support, and please remember to like, share, comment, subscribe, turn the post notification bell on, and I'll see you in another video. Bye, guys.